All right. Well, good morning, everyone. It is 9:02 on Monday, June 14th, about halfway through the month here of June and half the year. But as always, start to reminder why we are here and why we are doing what we do, not just on this call, but in general, in the healthcare, and our mission to improve the lives of the community. Affordable healthcare. That's what we do every day. Go out there and help people. Even not for permission, just remember people's lives. This is very, very important, not just financially, but for our access to the community. We need to help those people that need to be connected with quality doctors, quality healthcare providers, and of course protecting that nest that they've built. Health insurance. So that's just for over okay. Okay, as always, we've got training. Okay, sorry guys, it looks like I lost you there for just a minute. That's on my side, I'm sure. But just continuing here, let's start like we always do. We've got training that is coming up in the form of AHIP and in the form of all the recertifications. But we do have training this week just to keep us on our toes with everything else. So this morning at 11, Devoted is doing their coffee and chat sessions. Please make sure you attend those if you're selling Devoted. If you haven't connected with one of the managers, this is a great way to do that. I can tell you that Devoted has been very, very supportive of agents that are out there selling in general. We did a very big and successful event over the weekend in the Jacksonville market, and it went really well, and special thanks to Eleanor out there, Miss Tootie, who was up there in Jacksonville, drove from Orlando to Jacksonville to assist with that event. And then also Kent, great job, and your team. And I really appreciate Nick putting that together and connecting Dedicated, the provider group up there, to be at those events with us. And so, the teamwork makes the dream work, guys. And, I'm really proud of our team on everything that they're doing to connect the doctors. But you got to know the health plan. So just going back to basics here, it's really important that, excuse me, that you're going after these events because they're there to help you, and the providers are there to help you. So, but you can't do that unless you have a relationship. So again, this morning at 11, Devoted will be out there to answer any questions that you have in their coffee and chat sessions. Tomorrow morning, this is a special training that I will be hosting at 10 a.m. If you're interested in learning how to drive our 30-foot RV, I'm doing a special session tomorrow at 10 a.m. So I'm happy to guide anyone that's going to be there. I already have 2 people that will be at that training. This is for Orlando specifically. And I know it's short notice, but if you are interested in learning how to drive, I've got to do a quick training on that. So you can take the RV wherever your events are going to be. So, it is a complex machine, not to discourage anyone. How to run an office. Doing training sessions, just in our training calendar, so please make sure you don't what they've done. So job. Moving on to Wednesday. Wednesday is doing a brand new training system. This is an excellent program to be on. and, jumping on that Wednesday at 2 o'clock. Also, moving on Thursday, we've got a training on Thursday at looks like 11:30 to another coffee and chat session. The Jacksonville market, everyone. Also, Thursday the 17th for the Orlando market, all buyers getting doctors to work for you to connect with some of these doctors. On Thursday, if you're interested and another doc for 4 o'clock markets, and you want to join those doctor meet greet for you to do so. And then last training for the week, a healthcare and Medicare training. I really always love the VA training as a non-job. About the VA. You try to care about the military, so they know what they're doing, and then the veteran market. So if you're looking to break in or build better knowledge with VA, training to be on. So that's your training for the week. Remember, put in the classroom and the all time. You've been or but with that, AHIP is going to start rolling out. So we want to get our certifications done. On that note, let's talk about AHIP and prepping its ready for the season. Okay, make sure that you have everything that you need to get ready to go. What you're going to want to do to prep for the certification, and this seems basic. You guys need to make sure that each carrier has the correct email on it. With agents, that they weren't receiving emails or notifications. Well, what ends up happening is in their email address or their personal email address, HPM email saying carriers have that email on file that's communicating with you. Email issues. So you could have two different emails going so just make sure that you have the correct email file to carriers. This take 10 minutes to call up and ensure that you have a file with each of the carriers. This is just to prep you to make sure that you're getting all the correct information, the timelines, the deadlines, and what you need in order to get started with your AHIP. Now, several carriers are asking you to go ahead in preparation and log in to your account. So, for instance, AHIP, we've got the link here in AHIP. I'm sharing my screen here for those of you that are online. So AHIP, you're going to go to ahipmedicaretraining.com, and it'll pull up this front page here, and you'll just need to make sure that you log in. Okay? If you've saved your username and password, that's great, but what they're going to want to do is you're going to log in, make sure that your login works. Again, if you reset the site, in fact, there's a notice that says first time you access the new site after 5:10, you will need to use the forgot password link to reset your password. So if you haven't logged into AHIP since May 10th of 2021, this year, then you're going to need to reset your password. So that pretty much goes for all of us, okay, unless you recently did AHIP. So here's where you log in, and then you're just going to walk through that and make sure that you get that taken care of. It's really good to make sure that you have a password piece of paper. I know Jessica creates that for you guys. So if you have, multiple passwords, it's offline, in a notepad, and tracking those things, because you guys are going to be logging in and out of AHIP and all of the certifications. So make sure that you've got your email on file, and make sure that you're logging in early right now so you can get access, so you're not getting frustrated when you're like, hey, I want to go take the Aetna test, and you go in there and you do all these stuff just to get in, and then it just kind of knocks you down. So prepping yourself is go ahead and log into each one of the sites and find where you're going to be doing your trainings, okay? And you can't do that without having a proper username and password. So please make sure that you go in there and check your username and password, make sure everything's working, and so you're ready to go. Also, when you first log into those portal systems, take a few moments before you start your tests, or even this week or next week, go through the contact information that they have on your profile. This is really important. If you have moved, or again, if you change your email address or your phone number, you want to make sure that these carriers have the correct contact information. Not only just for compliance purposes, but in case something happens or that you're even getting the information. Some of these carriers are going to be running contests. You're going to want to know about those things. Maybe there's a delay in commissions or an error. If you're not getting these communications, then you're going to be left in the dark. So make sure your contact information is accurate. And then lastly, just know where the tests are going to be. Okay, and I kind of mentioned that earlier. Once you log in, once you get your password, once you update your contact information, you're in the portal, go ahead and just make sure that you know where the training's going to be on that website. Write it down, take a screenshot, circle it, whatever it takes, because you're going to have several different carriers, and it's just going to be so much smoother for you to take a couple of hours and do all of this prep work in order to get ready to go. Now, as I mentioned before, testing is going to begin next week, so we do want you to make sure that you're reading the modules, you're understanding the modules, and you're attempting to take the test. You have to take the test on your own. Okay, guys, we will not take the test for you. We cannot take the test for you. However, we will have proctor days at health plan markets. So if you want to come in and get some, your questions answered on some of those quizzes that you took, or if you have questions on the actual modules themselves, the team is going to be setting up some days for AHIP in early July. Okay, we're going to wait until early July before we go ahead and roll that out for everyone to come in. But we do want to encourage you to take it at least once. Go through the trainings, go through the modules, take all the practice tests and quizzes, and then the first time, please make sure that you go ahead and try it on your own. Because then you don't have to worry about coming in or any of that. It's done. If you do not pass the first time, please do not attempt it again without talking to us. We want to help you, or talking to your manager, because we do want to make sure that you pass the test. So don't move forward if you've already failed at one time. I will also tell you that you still only get 3 shots at AHIP. You can purchase additional AHIPs after the 3 times. You can purchase a second AHIP. This is called AHIP 2, but some carriers, if you failed the first 3 attempts, even if you pass it on the 4th or 5th attempt because you bought AHIP again, I will tell you that some carriers do not accept AHIP 2 as a form of certification. So that's why I say it's still really important that you pass it within the first 3 attempts. Okay. Let's move on to reporting. Many of you are doing sales out there. I'm seeing those out on the app report. I very much appreciate you guys reporting your applications. However, there's a few of you that are new or just have forgotten to report your applications. For now, this is still the way we need to track applications for several reasons, okay? So I have it shown here on the screen. This is your report app tool. Jonathan sends this out every Monday and Thursday with the team leaders board. It's a link there in that email. Just make sure you save that link. And this is how you go through the reporting process. Now, guys, reporting your applications, I know it's a little bit extra work, but I'm telling you right now, we have saved a lot of headaches by ensuring that this has been reported. Agency owners, leaders, you all will have eyes on what your team is doing, which is really important, and then just making sure that everyone gets paid properly. Okay, so that's part of it. The other part of it is we've had a couple of compliance issues that pop up here or there, and without the information from the application, we're unable to assist you with those compliance issues. If we're pulling up, okay, this was the effective date, and we have the information that we need on the app, we're able to help you. But we can't do that unless you report. Okay. The other thing is this is now integrated into the CRM system. So if you're using our CRM system, this is automatically dumping out to your CRM. So you have that information on your clients 24/7. You can run reports. Just a couple of quick stories here. The first one is we've had a couple of providers this year that have decided to terminate their relationship with one of the health plans. So if Dr. Y decides, hey, I'm going to cancel my contract with Plan X, well, you need to know if you've put any people in that doctor and with that plan. And so there's no way that we can track that unless you tell us, that member lives there. And that's done when you type in the name of the plan, the health plan. So if you enrolled them with Aetna, and then down at the bottom it asks you who the primary care doctor is. And you want to be accurate with that. You put in the primary care doctor, first and last name. And if you know they're part of an IPA group, so for instance this one was Centerwell now, FPG, you just type in the doctor's name. And that really helps us track in case one of your providers terminates their relationship with the health plan. So reporting is very, very important on so many different levels. We really want to make sure that you're reporting. Now, with HPM Shop that's beginning to roll out this month, several of you are going to be contacted early through beta testing. I know Jonathan's been working with some of you. And we're going to have a full rollout at the end of the month that we will be inviting those folks to. And so what we want to do specifically is make sure that you understand that enrollment platform. This is going to simplify your life. Eventually, you will no longer have to report, but for now, we still need you guys to make sure that you're plugging in your applications until we get it synced up into our CRM system. So please, please, please make sure that you're doing the reporting. And then, again, going back to prep, you're going to want to reach out to your members for AEP again, right? How will you do that if you do not have them organized in a CRM system, organized on a spreadsheet, organized for mailers, organized to do a text message blast or a phone blast, or to have your marketing support call and help you set up appointments? If you don't have this information in the CRM, if you're not reporting it, you're going to have a heck of a time getting organized for AEP. So if you haven't been reporting, please make sure that you do this report. This is the app report here. If you don't have the link, you can't find it, please reach out to any of us and we'll be glad to send you over the link so that way you guys have it. Okay? Very simple to use. It takes less than 5 minutes to plug in your app, and it's saved forever and ever. Amen. Last story that I will tell you on the reporting, just as a reminder, is we had an agent a couple of years ago that used the app report, but she kind of was using it here and there and whatnot, and maybe had some old business that she wasn't reporting before. Well, unfortunately, her laptop died, and it died beyond repair. The hard drive was fried, and all of her application information on the computer was lost forever. Okay? Now, The apps that she reported to HPM, we were able to pull up and send her the full report within 10 minutes. So we save all that in the cloud, it's backed up, and again, it's very, very important that you report in case things like that happen. You know, everything is organized into one place and saved for you, okay? So that's what I'll leave you with on the reporting. Now, a couple of opportunities and things that are coming up here. Just want to talk about marketing just for a minute. I really think that what I'm seeing here is a trend of cross-selling, specifically if we talk about the health insurance with dental and vision. I'm seeing those agents that have been working the cross-selling angle with massive success. So now it's a little bit slower. You know, you have products in your portfolio. Those of you that are set up with Humana, United, Aetna, you all have some ancillary products that you can reach back out to your clients and talk to them about. Dental is still one of the top 3 ways, that, or reasons why people are switching their health insurance. Okay, it's one of the top 3 ways. So if you're calling and getting ahead of that on your clients and saying, hey, do you need additional dental services? You know, whether you're doing ACA business or you're doing Medicare business, it's really important that you reach out to them and let them know that you offer these products. Okay. Now, there's additional compensation for this. Yes, it doesn't pay a lot, but if you can add an extra $2,000, $3,000, $4,000 to your income this year, what would that do to your lifestyle? What would that do for you, you know, specifically? Okay. Now, it's also proven that when you're looking at client retention rates, you are 50% more likely to keep your client if you have 2 or more products with them. Okay? 50% more likely to keep your member happy and with you if you have 2 or more products with them. So if you just have a Medicare Advantage plan or an ACA plan with them, they're a little more likely to change from you to another agent unless they have another product. And dental is an easy product to offer. With the Humana plans, I think you can help them get set up with a dental plan for less than $13 a month. It's pretty awesome. And then don't forget about vision as well. You know, yes, some of these carriers cover glasses, but it's limited. Sometimes it's limited on where you can go. So adding a vision plan might not be a bad idea for some of these folks as well. If they have vision concerns, or maybe they use vision a little bit more often than the average bear, you know, take a look at that for your members. Upcoming dental work, you know, adding an additional dental plan in relation to your Medicare Advantage plan could really change their lives. And then, of course, puts a little bit of extra dough in your pocket there too. But it also solidifies the relationship and gives you the opportunity to call your clients and then build that relationship again, and making sure that they know that you offer those products. Even if it's not for them, you can let people know, hey, I'm out here, you know, obviously you know I help with health insurance, but I also have dental plans in case anyone else needs my help. I can help with dental. And those are low-cost products. So let's say the neighbor says, you know, I'm really happy with my Medicare plan, but yeah, I want to talk to you about dental. If you get them signed up with dental, they're now on your client list, and you can call them for Medicare Advantage plans. So you don't have the same regulations with the no cold calling if you get those folks set up with a dental and vision plan. And there's no restrictions on how you do your marketing, but we'll talk about that at a different time. Dental and vision cross-selling, it could be a really good addition to your strategy for the rest of this year. So keep that in mind as we're getting through trainings and focusing back on marketing. Okay, you guys got a lot on your plate this summer. Just a quick update also, those of you that sell United Healthcare, their AARP supplement product, if you sold, I think, 1 or 2 of their supplements, you will be eligible for a free AARP membership. Now, I'll tell you that I'm 39, and I got my notice that I will be getting an AARP membership in the mail because I had sold some Medicare supplements in the past. with United Healthcare, and they're still on the books. So if you've sold, it doesn't matter what age you are, you can get your AARP membership early, and it's got things, I mean, phenomenal things, you know, discounts on, you know, hotel, travel, restaurants, you know, entertainment, services, really cool benefit that you have. So those of you that are selling United Healthcare, wanted to remind you about that because it's a really cool and interesting feature that you have available, you know, just selling a couple of supplements. So really, really cool little benefit that I like as well. And then lastly on my agenda this morning is I do want to talk about the Walmart stores, okay? Walmarts are now becoming available, but I'm going to give you guys a quick rundown on what is happening with Walmarts. Now, first of all, I want to say thank you to Jonathan, who's been organizing the Walmart effort, and he has done a phenomenal job now and also in the past. But I will also say that things have changed dramatically with the Walmart stores here, with what we've learned here this year. So yes, Walmart is offering stores. Yes, we have put in requests for stores. And again, if you all remember, we sent out notifications in February and March about requesting your Walmart stores. Those of you that did that, thank you very much. And the Walmart stores that are coming back, first off, we may have those eligible, those exact stores that you requested, or we may have one that's close or similar in proximity to those particular stores. However, in the past, it's important for you guys to know that these stores are not free. They are not free. They cost money. Each store, last year and years prior, each store cost $500 to secure, and if and only if the agent that was assigned at that store completed all of their trainings, had no compliance issues, was on time, and had you know, a good reputation for being at that store, half of that funds, the $250, would be returned to the payer. Okay, so that's what was happening in the past. Okay, now Walmart, because of the supply and demand, has decided to increase the cost of each store to $1,500, $1,500 per store with no optional refund. That means the total out-of-pocket cost is $1,500 per store. This is a massive uptake. It's 300% increase on the cost of these marketing sites. So with that said, we have noticed that a lot of stores, to our surprise, have come back up for grabs. Okay. Now, traditionally, the way it worked is if you had the store locked down in the past, you know, you paid your $500, you got your $250 back, however that worked. And some of you didn't have to pay for stores in the past at all because Health Plan Markets arranged to get that cost covered for you. And we are going to continue to try to get these costs covered for you. I'm going to come back to that because these costs are very expensive. Just as an example, if we secure 10 stores, that's $15,000 in marketing costs. A very, very high number for us. So yes, the stores are coming available, but they have come at an extremely high cost. So I want to keep everyone aware that we are doing our due diligence. We're doing our best to see if our carrier partners, our providers, and some of our other agency folk are trying to get these costs minimized or possibly covered for us. However, there may be a possibility that we will ask you as the agent to participate in an out-of-pocket cost for these stores. I don't know what that cost will be just yet, but if you are unable, absolutely unable, to help pay your portion of these stores, please let us know immediately, okay? It doesn't necessarily mean that you will be taken out of the stores. It just means that I need to know who's willing to invest in themselves, just in case it comes down to that. Obviously, we don't expect you to pay the full $1,500. At worst, I believe we'll be able to cover 50%, but we do have to talk about that because it is massively expensive, and this was not in our budget for this year as Walmart has done this massive change. The other thing that you have to know is that Walmart has started their own insurance agency. And Walmart owns an insurance agency that specializes in Medicare Advantage plans also. So it's inevitable that they will be picking the best stores and putting their particular agents working those locations. Whether that happens this season or in future seasons, it's important for you to know on what's going on with these Walmart stores. We may be at the end of being able to do Walmarts in the future, but you know, as of right now, it's very expensive. It looks like they're scaring off a lot of people with this massive increase in cost in order to man these stores. But we do want to ensure that the stores, if you're able to help financially, that will definitely give us a little bit more confidence in securing these stores. We do have a timeline for this as well. I do know that Jonathan is working diligently to get some more details on that. But we may, again, the moral of the story is we may ask you to participate financially in these stores this year just because of the massive increase. But like I said before, we're doing our very, very best to see if we can get our partners to help sponsor this effort as well. But I want to give everyone the heads up that we could possibly say, hey, look, guys, I'm sorry, but we do need to ask you to help split the cost of these stores. So just to prepare yourself, if you are like, yes, Justin, I'm definitely going to do this, whatever, you know, if it costs me a couple $100s, which at most I think it will, start saving your money now, put that aside, because that investment may help you secure the Walmart stores. I will also say that if there's production in those stores, specifically with certain carriers, it is very likely that I can get you reimbursed after AEP, after everything's been said and done. And then the other thing is once you secure the store, that's your store until you say it's not anymore, which is what's happening right now. A lot of people were paying out of their own pocket, you know, the $500, the $250, and a lot of these stores are coming up for grabs. And so once you secure that store, it's yours, and you'll get first right of refusal for next year. So yes, it's a nice marketing site, but those of you that have worked Walmarts in the past, it's not your end-all be-all. You know that you still have to work with providers, you still have to do your mailers, you still have to work with your clients. And those of you that know the Walmart stores, you know how powerful they can be if you're in the right location and you know how to work them. So don't mean to discourage anyone. I just want to make sure that we have transparency on what's going on with the Walmart stores, so you're not in surprise. So that's it. I see we have a couple of chats here, so I'm going to go ahead and pull up the chat, see if we can pull this up here, and then can answer some of those questions for you guys and see what we got. Here we go. Okay. All right, the first one. Is Walmart introducing their own agents this year? I had read about that. Thank you, Marissa. Yeah, I did cover that. Walmart did start their own agency. They are hiring their own agents. So I have gotten notification that that is happening. Again, I don't know exactly when and if that's going to affect our market. As of right now, the Walmart stores that are coming in, you know, once we pay for them, once they're loaded into the system, they're going to be ours. I do not believe that we will have any interference with their agents at those particular stores. Also, what I did learn about Walmart's agency is the fact that the majority of it is pushing it to an 800 number, which makes me believe that it's going to be call center based. Again, you know, people that are coming into Walmart might grab a flyer and then call that number. So I don't know if they're going to have any local agents in your market competing with you, but at your particular store, if you pay for it, if you're there, you will not have any interference with their agents. Rissa, you also asked, will there be other retail locations available? Yes, we are working with Aetna. They have the CVS locations. United Healthcare is pretty traditional with their Walgreens stores. Freedom may have Publix available as well, sometimes Winn-Dixie's. So there may be other carrier opportunities as well. Again, if you are looking for more of those opportunities, make sure that you send Jonathan an email. You know, I made sure that everybody had the opportunity to put in a request in March. So if you haven't put in your request, please send an email. I just shot it over in the chat, jminotti@askhpm.com, and we can put that request. It's a little late in the game for requests, but we'll take it in case we do get a store, an opportunity that pops up, you know, in the future as we go forward. Okay, so great questions. Thanks, Marissa. Appreciate that. So with that, what I'm going to do is I'm going to open it up for any questions that you guys might have. Let me go ahead and do that. Bear with me 1 second here. All right, I have you all unmuted. Does anyone have any questions this morning that I can help with? Any additional questions that I can help with this morning? All right, guys, if that's it, I appreciate you guys being on the call this morning. Thank you very much for your time. And just remember, we're going to be posting these on YouTube, so if you need a reference, please let us know. Thank you and have a great day.